Department of Elder Affairs helps fund a network of memory disorder clinics to conduct diagnostic evaluations to determine if someone has probable Alzheimer's disease or related disorders. Gail Shepard is here to tell us about these clinics. And Gail, I had no idea that there were these clinics, and you just mentioned there are so many of them here in the Central Florida area. But first of all, let's talk about this. What is a memory diagnostic clinic, a memory assessment? What's all involved with this?
So a memory disorder clinic is a specialty clinic where we see patients and also caregivers to provide support and diagnosis of a memory disorder.
Mm-hmm. And so, as I mentioned, there's several around the state and right here in Central Florida. So what are the numbers?
So throughout the state of Florida, we have 17 as a total.
Mm-hmm.
And here in Central Florida, we are very lucky that we have 3. We have Advent Health, we have Orlando Health, and then on the coast, we have Health First.
So I've seen, advertisements for, like a memory screening or some sort of a diagnostic thing. But these comprehensive assessments are a whole different ballgame. This is really, as the name says, comprehensive. It's much more involved. So what's involved in these assessments?
The comprehensive assessment, we do some of the similar as what you would get in a memory screen. We do a cognitive test, but we really look at the whole person and the whole picture. We try to figure out what is going on with the underlying issue. We know that there's many issues that can cause memory disorders, and we want to make sure that we're ruling out any treatable conditions.
Because that's what I would imagine. You would look at the whole person if there are any other pre-existing conditions that could be affecting their cognitive abilities, I imagine.
Absolutely.
So, all right, we've come to this assessment, and this is really something more than someone would get just at their primary care physician's office.
Yes, this is much more in depth. Usually it's a multi-visit appointment to a clinic. Everything's not going to necessarily happen in one day. You may come in for the first visit and it's longer, extensive. This is our information gathering appointment. And then you may have to go back and do some orders, some labs, some radiology reports. We'll see what's going on and gather any additional records that we may be able to. And then when we come back, we can give a better idea of what may be going on.
You can get that whole comprehensive evaluation of the health of that person. Now, is there a cost to this? Is it hooked with insurance or Medicare, Medicaid, anything like that?
Most insurances actually cover the assessment. There may be a copay depending on insurances. There's also opportunities available for people who do not have insurance or funding. And I would recommend reaching out to the memory disorder clinics to talk to them individually about the funding that's available.
To see what possibilities are there. And I'm sure this is important, obviously, for the patient, but gosh, it must really be important for their caregivers, their family members as well.
Absolutely. We are very supportive of the caregivers and the families because we know that the disease, dementia, does not just affect a single person, it really affects the whole family. So we're here as a support for the families to help guide them through the process, prepare, and make sure things are in a line. And then, when there are some difficult times, we're here to support and help guide to some resources.
And so obviously, they have that opportunity to visit one of these clinics, and I'm sure we'll have the information available for folks. And that way, they have that answer. It's more, we often advise folks take charge of your health, not just your physical health, but mental health as well. And that's probably where these clinics come in.
Absolutely. We are very lucky to have social workers within the clinics that can provide that support to the caregivers, to the patients, to talk through some challenging times that they're having and help connect to the resources that are here in our area. And we are very lucky to have several resources in the area.
And I'm sure there's probably some other opportunities, other possibilities for people to get these comprehensive assessment tests, not just at the clinics?
There are neurologists are able to provide a diagnosis, psychiatry, and geriatricians. Some primary cares are geriatricians, and they're more familiar with the dementia than
Well, that's terrific. Thank you for such a great summary of the state's network of memory disorder clinics. Terrific information. Thank you.